An ectopic pregnancy is a condition that happens outside of the uterus. This occurs when a fertilized egg implants in a location that can't support its growth. Some medical experts laid emphasis on the severity of the situation, especially if the pregnancy occurred in the fallopian tube or abdominal cavity.
Those are not the natural habitats or the natural place where a pregnancy should develop. And so this pregnancy constitutes a risk and a danger to the woman carrying the pregnancy. It is one of the leading causes of maternal death. Very rarely we have some form of birth control methods that may also increase the risk of ectopic pregnancy.
For any woman who has had ectopic pregnancy in the past, you are prone to having ectopic pregnancy in the future. Secondly, cigarette smoking. Thirdly, there is sexually transmitted infections. So recurrent history of sexually transmitted infections, especially sexually transmitted infections that go untreated or are not treated on time.
They also spoke on ways to prevent the life-threatening pregnancy situation.
One of the ways of going about that is to encourage young girls, because most of the times, it can be anybody, but most of the times it's women or girls in the reproductive age group. They are prone to that and they don't seek help early. So when they have this the symptoms of pelvic inflammatory disease, they might not go for any treatment or go for poor treatment.
The treatment for ectopic pregnancy could either be done through medical means or surgical means. But you need to go to speak with your healthcare provider, your specialist doctor, to let you know which will work for you.
While describing the condition as rare and occurs in approximately 2% of all pregnancies, the experts charged expectant women to seek early medical care.
If she has had pelvic inflammatory disease and an ectopic on one tube, is likely she will have it on the other tube. So that's why we say if she gets pregnant again, she needs to come early so that we can localize the pregnancy and make sure it's not in that tube. However, if that other tube is not affected, she can have children.
Ensure you maintain safe sexual practices. So you either abstain from sexual intercourse, or you have a partner who is faithful to you and you're also faithful to the person.
Prolonged retention of the diseased fetus in the abdomen, especially if it has been attached to other organs or vessels, can increase mortality rates. Iniyekenimi Dubamo, AIT News, Yanagoa.